The procedure that we're doing today is called sclerotherapy. It's a treatment for thread veins and spider veins. It's a treatment that's been used for quite a few years, and what it actually does is we inject the blood vessel with a solution and it'll get sticky. As the blood goes out, the actual solution goes in and sits on the vessel wall. Over a period of about 3 or 4 weeks, it's becoming inflamed and gets irritated on the area and sticks the vessel together. Most clients will need more than 1 session with it, so what we actually do is inject, wait between 4 and 6 weeks and re-inject again. What will happen, it's a little bit like a trunk of a train. One of the blood vessels, maybe quite a few of them, it'll look a little bit red afterwards, and there'll be a little bit of a bump on the injection site. Lisa will be wearing stockings afterwards, and the compression stockings for a few days during the day, and this will help the solution to obviously work a little bit better. Right, so what I'm doing is obviously starting at the bottom of this little vein here, and it literally sits in the skin, and as you can see, the blood's flushed out of that area, and it's feeding a few more around that site as well. So that's enough in, because when I feel a little bit of pressure, when I'm injecting, I know that I've got enough in there. When the thread veins are very tiny, they look a red colour, and you can see that they're a lot thinner. When some clients come in and they've not had any treatments on them, they can be very, very blue and very thick. If you keep an eye on the thread veins, and obviously when you see the new ones coming back, actually have them injected at the point of when they're red rather than blue, because you'll need less treatments on that area. I've been injecting now for 21 years with this treatment and find it's probably the best one that I've tried. The laser treatment is very good for facial thread veins, and obviously I can inject facial ones, but I'll leave that to the girls to do with the laser. For the leg ones, they find that they get a better result with sclerotherapy. So as you can see, you've got your little marks there, and they'll settle probably 5 or 6 days. That's settled for you, isn't it?
Yes.
Okay. The sclerotherapy treatment, a lot of people get their legs out for the summer and tend to have the treatment in the summer, where they're probably better off having it in the winter, which I think you learnt your lesson with that one, because you've got to wear the tights for a few days afterwards, and obviously they're quite thick compression tights. So if you're thinking about having your thread veins done, then what I'd suggest is doing it over the winter period, so by the time summer comes, you've got the result that you're looking for.